So, hi Tracy, do you want
Hi.
to tell us about what you do?
I'm an occupational therapist working in the Falls Therapy Service.
How about you, Stacey?
I'm also an occupational therapist, but I work in the Telford Intermediate Care Service in Telford. And what do you do?
I'm a physiotherapist and I'm also an intermediate care services but based in the southeast of Shropshire.
Yeah.
So how long have you been in your post, Stacey?
So I've been in post, I joined just before COVID, before the pandemic hit. So about 3.5 years I've been in post. I personally prefer it to the acute setting. So
Yeah.
it
same.
has a better work-life balance for me personally. So yeah, and how about you? Did you?
Yeah, I started my career in the acute unit, which was very much a traditional route for physios after qualifying. So I was quite sort of standard in that respect. And then my career's taken several different pathways in terms of living overseas and also going into a few different roles involving healthcare management and commissioning as well, just to add in a bit of variety. And then having gone abroad and come back, but my background is very much community-based, and like you, that's what I enjoy. I like the variety of the work in particular, in that you can go from a respiratory patient to a back pain to a stroke patient, and that mix of a caseload is what I really, really enjoy. So I was quite happy when they asked me to come back out into the community base, and I've been there ever since.
Very good.
I started in hospitals as well. I did a rotational post from
same.
university.
Same.
Same.
So you get sort of 4 months or 6 months in lots of different departments. And then found I was doing more with older people, so community was the logical step.
Yeah, exactly the same.
I prefer community as well.
Yeah.
I do think though that had I not started in the acute setting, because you do learn loads, because you're really thrown in at the deep end. And so probably the first half of my career, I did get a lot of support. So now that I'm in the community, I very much appreciate all that I learned in the acute setting, because I really find that I'm quite often falling back on the knowledge that I learned when I worked. You don't realise it at the time, but
I think it gives you that sound clinical basis, doesn't it?
It does, yeah. But at this point in my career, I'm definitely happier, more settled in the community, because you have a bit more autonomy, I think. Your work-life balance is a bit better. There's more flexibility in the job. Sort of when you start and when you finish, it's a little bit more flexible, which is what I need. So,
and I don't know how you guys feel from an OT point of view, but certainly from a physio point of view, when I first qualified, there weren't really jobs at that level in the community. It tended to be just more senior physios that worked in community teams, and it's been good to see since I've come back into the NHS that that's really changed. Right from band 5, 6s and 7s, sort of, I think it gives you a much better career pathway if you feel your niche is in community rehab in particular, which that never existed back when I first qualified.
And then 5 rehab techs.
Yeah.
So we all do, a very similar job day to day, but rely on each other's sort of expertise when there's particular issues.
And now there seems to be much more of a team of rehab techs that work with us, which really support us in our roles.
We do very much rely on the therapy assistants
very
a great
much so.
deal. And if for any reason there is a vacancy, in a TA position, the team really feels it.
I agree.
You notice the difference.
Yeah, I don't think we wouldn't function.
Yeah, you don't
Yeah,
function
especially with
without
5,
that.
they're the majority of your staff really, aren't they?
So as a band 6, some of our sort of day-to-day roles are more to do with the development of the service and training, and a lot of sort of triaging the patients that are referred to us to make sure they're coming to the right place at the right time.
Yeah, and I think particularly when even as a new rehab tech, as they develop in a post as well. Do you both have students in your teams?
We have a physio student at the moment.
Yeah, we've had OT students from Coventry University. It was when I did a student placement in the community as well, that it opened my eyes up to working in the community. And I don't know, I think it's a little bit of love or hate community work. I think we all love it, but we have had some students who I think are quite terrified by the thought, because we have such a varied caseload and work, like you said, Stacey, very autonomously. I think some people do prefer to have a team of people around them in an acute setting. But yeah, I think I always knew it was going to be.
We're more outpatients than community, so we don't go into people's homes.
Of course,
They come to us at a community venue. So that still has its own sort of stresses, that you're working from a non-NHS building, you know, a village hall it could be, and people are coming to you for their appointments. And that was one of my first jobs, was going around the county looking at what everybody was doing, looking at what the guidelines were saying we should be doing, and then trying to draw it all together so that wherever you were in the county you were getting a similar service.
So you've been very much part of the service all the way through then, Tracy.
That's
highs
good.
and lows,
Yeah.
Is that in Shropshire and Telford and Wrekin?
No, until recently Telford had different commissioning, so the commissioning is for Telford and Shropshire is all one now. So things will change. But at the moment it's still slightly different depending on where you live, Telford and Shropshire. We're a specialist service, but we're not the only service that deals with people that have fallen. So we're there for if people have got specific, you know, difficult cases that they want to discuss with us. The training has come out of the sort of general sort of decline in people's abilities over COVID and the lockdowns. There were a lot more falls on the community hospital wards. I definitely prefer being face-to-face with patients rather than the admin and the training.
The patient contact,
I find the training quite daunting, actually. It's quite hard going. It's you know, I suppose when you've worked in a career for such a long time, you're sort of used to the
hands-on
some
clinical
aspects rather than others.
Yeah. And you mentioned, Stacey, that you really like the work-life balance with your role, and like me, the variety of the job.
When I first joined the team, it took me a little while to get used to the generic working. So that I suppose I had to upskill a little bit in terms of the mobility side of things, because we used to, when we worked in the hospital, that was just all physio stuff, whereas now everybody on the team, and equally physios that go in to see somebody, if they need a hoist or pieces of equipment, then the physio has now been upskilled to recognise. But then we do very much support each other. So if I have a patient that particularly has a shoulder injury or a frozen shoulder and I don't know how to assess it, and it's really I'm not qualified to do that, then the support is there, and so we support each other. And equally, if they have a quite a complex patient that might have some, you know, specific handling or seating or something like that, then we support each other, or some cognitive problems. Then the physio will call us, and then we work together on the case. So it is nice having that support there as well.
So I'm a bit unusual as an occupational therapist, because I actually run exercise classes.
Which traditionally you would think of more as a physio role, wouldn't you?
When I first started doing that, it did take a while. You know, it felt like I was sort of stepping outside of my role. But having worked in a generic team and with other professionals, you realise that, you know, you can. You've always got that professional identity inside you, and you bring that to whatever you do. So I run exercise programs very differently to maybe my physio peers or my nursing peers or the rehab techs. So I think together as a team, you all bring something different. You all look at things slightly differently, and that's got to be better for the patient, hasn't it?
That's a good point.
So do you think you'll stay in this role now, Tracy, for the rest of your career, or do you think you'll look to move into something different?
It's continually evolved from when I started. So, 2 years ago, we were working very differently. 5 years ago, it was very different again. So it is continually evolving. So I enjoy it. Yeah, I do enjoy going to work. So.
Yeah, very good. And do you miss the clinical side of, because you don't do as much clinical work now?
Well, I think I'm slightly unique in our team in that because I'm actually employed as a bank physio rather than on a permanent contract, which is my choice to give me a little bit more flexibility as well. I work set hours and set days, so I don't cover the rota as such as part of the full team. So we decided when I came initially into the team that I would actually take on more of a rehab role and see patients off the waiting list who were what we would more traditionally call, a physio rehab patient, rather than things like the work we do around admission avoidance or the early supported discharges, which are the other sort of two mainstreams. So I would say I'm a little bit unique in our team that I do very much use my physio skills on a day-to-day basis, and I very much advise other members of the team as well, because like you said, Stacey, the work can become very generic in that we very much support each other, but everybody develops different skills within the team.
Yeah. Because we were one of the few teams that kept up and running. So during COVID, we had pediatric therapists working with us. We had any team that had closed down over COVID seemed to join us.
They were redeployed into our teams.
Team. And then we had a really quiet lull. So we had all these people and hardly any referrals because everyone was told to stay home and nobody wanted to go to the hospital in case they caught COVID. So, and then after people were sort of deployed back to their teams, we were just inundated with referrals. And I think because, this is only a theory, but I think because those other teams were redeployed and people weren't sending those teams the referrals, all the referrals came to us.
I agree.
So it's a little bit time consuming.
Yeah,
but,
now that everything's up and running pretty much normally. Yeah.
So I guess that's where our training is coming in, because we're trying to sort of inform people of, depending on a person's abilities, where their needs will be best met, knowing that a lot of what we all do is dealing with people that have fallen. It's, what that person is able or not able to do will depend on which service they see, and trying to get that person to the right service at the right time is really important.
And
so do you have very long waiting lists?
Well, because we're working with groups.
Yeah, you're sort of, is it like a 12
So
week?
it builds up, and then it a big chunk of the waiting list comes away, and then it builds up again. So it's it fluctuates. So we're on top of it, I think.
That's good.
That's a good feeling.
Touching wood at that time.
That's a good feeling.
Yeah. But we were actually closed down during COVID.
I was about to
so
ask
that. Was a very
I presumed you were one of the services
that were
closed.
I was redeployed to the community equipment services.
Oh, okay.
So I was one of the early people to be redeployed. So I ended up running our service remotely, which is a bit bizarre when you're dealing with people that usually come to exercise programs. Trying to support people to exercise at home over the telephone is very different.
Some challenges.
Yes. So I had to sort of start up the service again, without being face to face, which was quite difficult. But we got there in the end.
But you find now your level of referrals is sort of normalised.
Yeah, we're the same. We get a lot of people referred that aren't really appropriate, because they've got to be able to get out of their house and get to a community venue.
Yeah,
to come
which is
and
why
see
I
us.
don't refer very many people.
So we do get people that have been referred to the wrong place, which is sort of where our training has stemmed from.
Yeah.
So if you were involved with students or newly qualified staff, what would your advice be to them, Stacey, in terms of working in a community trust?
I think you do have to have a pretty good understanding as an OT student what your role is. So when you come into the community team, you know, if you have to understand that we do work a little bit generically, but also, and maybe it helps the student to solidify and their greater understanding of what a core OT role is, you know, when they see you working a little bit more generically. So, and I suppose it's just being, you know, very flexible and being able to swap and change your day. You know, that's important as well. But I think in our team, you know, with the students, we do and try and give them a variety of people to work with. So they might go with the rapid response team, they might go with the social workers, they might spend some time with the physios and the techs, so they can see, you know, the varied roles that they do have. And
understanding the pathway that a patient might follow as well, from hospital discharge to, you know,
positive
through to a more sort of rehab service.
Yeah, I like the reference you just made to the fact that your day often changes.
Oh,
and I think that's one of the
like
key
today.
skills we have.
I'm supposed to be on triage on duty all day.
I think that's something we learn to deal with in the community a lot more, because no matter how well you plan your day, things inevitably change, and any urgent referrals that come through that do need, and I think that's a skill set you learn to develop with a community-based job. That again, I think you either love it or hate it. But that's something you do have to adapt to. And again, for me, that's what I like about the job, because I like that sort of ongoing sort of
one day
change in your
gives
day.
Variety.
Very
gives
much so.
variety to your day.
Certainly. Yeah.